Please rise for the pledge.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, the first item on the agenda is motion to recess the commissioners meeting to hold a retirement board meeting.
Motion.
I have a motion, do I have a second?
Second.
I have a motion and a second, any questions, all in favor? Motion to call the retirement board meeting to order.
Motion.
Second.
Motion and a second, any questions, all in favor? Motion to approve the January 17th, 2024 agenda.
Motion.
Second.
Motion and a second, any questions, all in favor?
Aye.
Motion to approve the December 20th, 2023 minutes.
Motion.
Abstain.
Oh, that's correct, great, I'll help make the second on that. All in favor?
Aye.
Under new business, motion to approve the refunds of contributions from employees no longer with the county. There are 6 individuals listed.
I'll make that motion.
Second.
Motion and second, any questions, all in favor? Motion to adjourn the retirement board meeting.
Motion.
Second.
Motion and second, all in favor?
Aye.
Motion to reconvene the commissioners meeting.
Motion.
Second.
Motion and second, any questions, all in favor?
Aye.
Any public comments or questions concerning today's agenda? Seeing none, we'll move on to number 1. Motion to approve the January 17th, 2024 agenda.
Motion.
Second.
Motion and second, any questions, all in favor?
Aye.
Motion to approve the January 2nd, 2024 reorganization meeting minutes.
Motion.
Second.
Motion and second, any questions, all in favor?
Aye.
Motion to approve the January 2nd, 2024 meeting minutes.
Motion.
Second.
Motion and second, any questions, all in favor?
Aye.
Motion to approve the January 10th, 2024 conference minutes.
Motion.
Second.
Motion and second, any questions, all in favor?
Aye.
Motion to approve payment from the general fund to county bills in the amount of $498,305.59.
Motion.
Second.
Motion and second, any questions, all in favor?
Aye.
Motion to approve payment from the Pike County Employee Health Insurance Fund in the amount of $85,338.05.
Motion.
Second.
Motion and second, any questions, all in favor?
Aye.
Motion to approve payment from liquid fuels in the amount of $12,792.67.
Motion.
Second.
Motion and second, any questions, all in favor?
Aye.
Under all business, motion to open bids for the tri-annual grocery and frozen foods for the period of March 1st, 2024 through June 3rd, 2024.
All right, we have 3 bids.
Need a motion?
Motion.
Second.
Second, motion and second, all in favor? Aye, Tom, open
All
that.
right, we got 3. The first one's from Bernard Foods. Can't wait the numbers, and no bid both of them. Total bid $14,538.28. That's Bernard Foods. The next one's from Cisco. Cisco's bid $230,288.89. And then I have Mozilla Foods. Mozilla Foods bid is
February 7th.
$225,530.21. These I want them tabled to be reviewed.
Yeah. So I'd entertain a motion to table the bids for the review by the corrections office and
I'll make that motion.
February, to make it for February 7th, after review by the correctional facility and the warden.
Motion.
Okay.
Second.
I have a motion and a second. Any questions? All in favor?
Aye.
Number 2, motion to authorize the chairman to execute the letter of transmittal for the Bennett Avenue interior renovations payment application number 1 from LH Reed.
Motion.
Second.
Motion is second. Any questions? All in favor?
Aye.
Motion to approve the following human service payment vouchers on behalf of the Office of Human Services. Whole home repair in the amount of $14,667. State food purchase program in the amount of $1,881.94. And Human Services Development Fund in the amount of $4,000.
Motion.
Second.
Motion and a second. Any questions? All in favor?
Aye.
Motion to approve the 2021 Community Development Block Grant Program Payment Voucher payable to Hailstone Economic LLC in the amount of $3,214.63 on behalf of the Office of Human Services.
Motion.
Second.
Motion and a second. Any questions? All in favor? Aye. Motion to approve the Pike County Home Program Payment Voucher payable to Gatehouse Media Pennsylvania Holdings Incorporated in the amount of $46.80 on behalf of the Office of Human Services.
Motion.
Second.
Motion and a second. Any questions? All in favor?
Aye.
Motion to authorize the chairman to execute the certification of county funds in the amount of $12,939 for 2024 program year on behalf of the Agricultural Land Preservation Program Board.
Motion.
Second.
Motion and a second. Any questions? All in favor?
Aye.
Motion to execute the lease agreement between Blooming Grove Hunting and Fishing Club and the County of Pike on behalf of the Conservation District.
Motion.
Second.
Motion and a second. All in favor? Motion to authorize the chairman to execute the contract of services between Penn Care Support Services and Pennsylvania Link of Monroe, Pike, Wayne counties on behalf of the Area Agency on Aging.
Motion.
Second.
Motion and a second. Any questions? All in favor?
Aye.
Motion to execute the fiscal year 2023 fourth quarter payments from the Pike County Emergency Medical Service Grant Funds to Blooming Grove Township in the amount of $133,521.76, Elmira Township in the amount of $80,000, and the Delaware Township in the amount of $53,750.
Motion.
Second.
Motion is second. Any questions? All in favor?
Aye.
Okay, under miscellaneous, the one thing I have is always the Penn State Extension calendar of events. I know the press is here and maybe the newspaper could pick up, but they're always looking for dedicated adult volunteers to help those programs. Those programs are really important to the residents of the county and particularly to the families and the children. So if you feel the urge, please volunteer at 4-H. The next thing I have is, I know we have Shannon Wisniewski here. At the last couple of meetings, there was questions about Narcan and how it was distributed, and what the cost, and how many were going out in Pike County, and where and how you're doing that. So can you give us an overview of that?
Absolutely.
Thank
So,
you.
and I brought Chris Sorrentino with us. He's actually our designated person for CCE. So when we originally talked about the Narcan distribution, I know the question came up of like the approximate cost. The cost has gone down significantly over the past few years. We said now it's about $45.
It's about $45 for a box that contains 2 doses of naloxone.
The amount it's, the double doses with the 4.
Mhm.
So how we've distributed over the past few years in Pike County is we've found that going to generalized community events, so we've gone to the Zane Gray Towers event up in Lackawaxen, we've gone to events down in Bushkill with the different communities, we've gone to events at Cambaconac and Dingman Township to be able to meet the community kind of where they're at. We've also done events both at the Delaware Valley School District and the East Stroudsburg School District and Wallenpaupack to make sure that the families are aware that the naloxone is available, as well as the Dispose RX to be able to get rid of prescription medications if they need to.
We've also been able to provide naloxone to your sheriff's department, to a lot of local agencies like Children and Youth. Also the local ambulance corps, I think every single one of them have gotten some naloxone from us. And we've been supplying them for the last at least 2 years.
And that's as well as the correctional facilities and any rehabs that we work with for people that are at risk coming out of those facilities to be able to access it.
Quickly, I just have a question. Would you be able to clarify exactly what naloxone can help with someone, if someone has ingested versus maybe something else it may not be able to really assist with?
Naloxone is used to reverse overdose on opioids. It doesn't work with any other substance. So if an individual is suspected of experiencing an overdose on naloxone or on opioids, any type of opioid, so that could be either the heroin, fentanyl, prescription, opioids like oxycodone. If an individual is given naloxone in time, it can help reverse that, the effect of the opioids by that person in time so that they can get the medical interventions that they need.
With things like, horse tranquilizer and things like that.
As I was, it
Right.
won't affect, naloxone will not have any effect on that.
Just wanted to clarify that, because I know some.
Well, and we tell people, you may not know what the person's overdosing on, you may not be aware, but it doesn't cause any additional harm if that's not what's going on. We don't expect somebody that walks on scene to know whether or not what you ingested. If they're not responding to the pain stimuli, their respirations are off, so we're talking blue lips, blue fingertips, and they're not responding, go ahead, call 911, administer the Narcan if you have it, and go from there.
I think that's the important message, call 911, administer the Narcan, and, you're doing the best you can in this situation, and wait until help arrives. Or help needs to arrive no matter what, even if they come back out. Before the ambulance gets there, because obviously there needs to be some intervention, and that's the one way we're gonna get intervention, is to make sure that people are stressed to call 911. I know people get fearful that they're going to be arrested or all of that, but deal with that. You can deal with that while you're alive.
And Act 139 in Pennsylvania actually prevents, in most cases, anybody being charged anyways. So as long as the individual who's administering Narcan calls 911, the goal here is not to have this be an arrest situation in terms of legal situations. It's about getting that person the intervention that they need so that they can, one, have their lives saved, two, hopefully then on the back end, get in contact with an agency like ours so that that individual can receive help.
Yeah, be the good Samaritan.
Quick question, Matt.
Go ahead.
Is Narcan less effective on certain fentanyl overdoses? I just heard tangentially that if you were ODing on fentanyl, that it may not work.
The effectiveness of naloxone is going to be based on a number of different circumstances. How much opioids that individual used, within what period of time has that person experienced the overdose. Obviously, if the person has witnessed a person, let's say, passing out from an overdose, giving naloxone is going to be more effective than that person who may have been unresponsive for several minutes before the naloxone is administered. That's why, again, the big push is about people calling 911, because administration of naloxone is like CPR. You're buying the person time. That's all you're doing. When the individuals come in from EMS, they have more tools at their disposal to help that individual. When that person gets to the emergency room, same thing. More tools at their disposal to help reverse the situation. You're buying that person those precious minutes. Because you can give naloxone to a person, you may see an immediate response where they're getting better, and there's other times where you may not get that response that you're hoping for because of any number of circumstances. Also because there's other drugs that might be involved in that overdose. Again, the naloxone will only work on the opioids. So if the person has used a combination of different drugs, then naloxone will not reverse benzodiazepine, cocaine, or anything else, or xylazine.
Well, the other piece too is the Narcan is effective for a certain period of time. Depending on how much they've ingested, they can go back into an overdose when the Narcan wears off. We know that, depending on which hospital you're going to and what area of Pike County you're in, we want to make sure that the EMS is available in case they need to re-administer the Narcan if necessary.
There might be a reason why there's 2 doses in one box.
Correct.
Yeah. Okay.
Thank you.
Is there any other questions for Shannon? Any other press or public comment? None? Okay. Motion to adjourn.